This programme has learned that hundreds of victims of the NHS Contaminated Blood scandal have written to the Health Secretary asking for an immediate increase in support payments. A public inquiry opened last month into how thousands of people in the 1970s and 80s were given blood products infected with hepatitis viruses and HIV. It's thought more than 2,000 people have died. Many others have been left in very poor health. The public inquiry into the scandal is not due to look at financial support until 2020. The chairman of the inquiry has said decisive action is needed. Our reporter Jim Reid is here with the latest on this. Jim, tell us what this situation is around payments.
So Joanna, this letter's gone out this morning and it's from a campaign group called Tainted Blood, which represents the biggest number of survivors in this scandal. And it tackles what is an immediate problem for many of the families, which is just simply making ends meet, just paying the bills. Now, as you said, more than 4,000 people were infected in this scandal back in the 1970s and 80s. In fact, the number could be much higher than that. Some estimates put it as up to 35,000. So we're not even sure of the numbers yet. Many, though, we do know are very, very sick, have been left in a very sick situation. As a result, they could not work, they could not hold down jobs. And in many cases, relatives have had to give up their jobs, their careers, in order to support their loved ones. For example, take the case of Bob and Sue Threakall. Now, Bob was infected with HIV back in the 1980s. He was a haemophiliac who received contaminated blood products. He passed away in 1991. I spoke to his widow, Sue Threakall, yesterday. She now helps work with this Tainted Blood group. And I asked her about the financial impact, not just on her, but on the community more generally.
Financially, it has been an incredible struggle. It's been completely traumatising for many people. People have had to sell their homes. People have been unable to get mortgages. People have been unable to get life insurance. We have instances, we've had one recently a few weeks ago, where someone was widowed, someone we all know very well, and she is in the throes of desperately trying to sell their beautiful forever home before the bank repossess it. Nobody should be put in that position because of somebody else's fault.
So, Jim, what do the victims want?
Part of the problem here is that no single compensation deal has ever been agreed with this group of people, ever. Instead, there's been these ad hoc support payments which are paid out either regularly every year or on a kind of sporadic basis. But the important thing is it's different depending on where you were infected across the UK. So take Sue's case, for example. Now, her husband was infected in England. She received a one-off payment of £10,000 as a result. If her husband Bob had been infected in a Scottish hospital, she would have received £27,000 every single year. So you can see the huge differences here depending on where you were infected. And that's because, of course, health is a devolved power, devolved matter. So it doesn't depend on the Health Secretary just in England. It depends on the assemblies, the parliaments in Scotland, Northern Ireland and Wales as well. And what this group are now saying is they want all the payments lifted to the highest level, so everyone receives the same. And in most cases, that is the Scottish level. That appears to be the system that pays out the most at the moment.
So what's the government saying?
Well, the government is coming under some pressure on this now. So last week we had the chair of this public inquiry, a public inquiry that opened just a few weeks ago into this scandal. The chair there took the unusual step of writing to the government, to the cabinet office, describing how the people he's spoken to are, in his words, on the breadline, and some of them had lost everything. He asked the government to take decisive action. Now we've seen this letter from victims. The problem is, as you said at the beginning, that as things stand, this is only going to be addressed when the inquiry finishes, and that could be 2 years, even longer, down the road. This campaign group say by then hundreds more people will have died. They want to see more immediate action. The government says it will consider these recommendations and it will act, as it puts it, as soon as possible.
And separately, another issue that's emerging through the inquiry is that some patients were forced to sign a contract promising to drop legal action before they were actually aware of the full extent to which they'd been affected by the blood transfusions.
That's right. So this is in the newspapers today. I don't know if you can see, this is the front page of the Daily Mail today. New Tainted Blood scandal, and it refers exactly to that. It's saying that people who were infected back in the 70s and 80s with HIV and hepatitis C, when they found out they were infected with HIV, were asked to sign a contract saying they wouldn't take any further legal action or they wouldn't receive any more compensation after that point. It's just one aspect that's starting to come out of this public inquiry. I think we can expect to see many more stories like this as we get more details about exactly what happened.
Thank you very much, Jim. Well, with us now is Diana Johnson, the Labour MP. She's the co-chair of the all-party parliamentary group on haemophilia and contaminated blood and is one of the leading campaigners for victims of this scandal. Diana, I know that you've been very heavily involved since a constituent came to you 8 years ago. What do you think, first of all, about what the victims are saying about the need for proper financial compensation quickly?
Well, absolutely. They need to be compensated, and they've never had that. There's never been an admission of liability by the state. That's the problem. That's why the government have given these ad hoc payments. I think what's interesting, though, if you look at what happened in Southern Ireland, they did make compensatory payments without admitting liability, and they were generous compensatory payments. So there's no reason at all why our government couldn't decide now, even though the public inquiry is underway, to say, right, we're going to compensate these people and pay them properly. Because even the financial schemes that we're talking about today and levelling up are still, I don't believe, adequate to really compensate people for what's happened to them and their lives that have in many cases been destroyed.
So what would you think would be the correct amount? Because when you talk about levelling up, I presume you mean to the Scottish level that Jim was talking about, but you still don't think that's enough?
I still don't think that's enough. I think in the interim that's one measure that could be introduced quickly, but I think what the government really need to do is pay proper compensation. We're talking about hundreds of thousands of pounds because of the effect this has had on people's lives. And also in Ireland they've done things like given them priority, this group, in terms of healthcare, so they're always at the front of the queue to get any healthcare procedures they need.
How would you ascertain, exactly what the level should be at this stage? Because this isn't due to come under the remit of the inquiry until 2020,
That's
which
right.
is, as seems to be the consensus, too far away when people are suffering now. But it needs to be properly scrutinised, doesn't it?
Of course it does. But in Southern Ireland they were able to do that, and we know within negligence cases in law there are ways of calculating the loss to somebody, the loss of earnings, the loss of enjoyment of life. That could all be done, I think. If the government had the will, they could do this. The other thing the APPG would like to see is that this group is passported onto the new welfare benefits that the government have brought in. A lot of these people now are having to go through assessments for employment support or personal independence payments and being turned down, and then having to go through a further appeal. So we say you should passport this group right through into these new benefits.
And just a thought on the people signing away their right to make further claims before they knew the full extent.
Disgraceful. And the state doing that to a group who at that stage knew they had HIV but didn't know what else they might have contracted from blood transfusions and factor VIII. Disgraceful. And this is why the state has harmed this group of people, and the state now needs to step up and compensate them properly.
Diana Johnson, thank you very much. And do get in touch if you have been affected by that and you want to let us know your thoughts on it, or the usual ways of getting in touch. Right now, let's join Rebecca Jones in the newsroom for a summary of the rest of the day's news. Good morning, Rebecca.
Good morning, Joanna, and good morning to you. Victims of the contaminated blood scandal have written to the Health Secretary asking for an increase in support payments. The public inquiry into the scandal, which is expected to take at least 2.5 years, has heard the number infected could go far beyond 25,000. Tainted Blood, a support group for victims, says it wants support payments in England, Wales and Northern Ireland to match those being paid in Scotland.